Welcome back. Dr. Hale is still with us as we continue to talk about hip replacement surgery. So let's talk about, you already talked about the procedure a little bit, but there are different approaches to the hip surgery. Can you talk about those a little bit?
There are. In the United States, there's two main approaches that are used now, about 50% each way. And there's something called a posterior approach, which most of us trained on. And then there's more of a newer approach called the anterior approach. And there's some different reasons why different people would get different approaches, and some pros and cons to both approaches.
Okay, so we talked a little bit about the recovery from knee replacement. What is the recovery like for hip replacement?
It's typically much quicker, actually, than the knee replacement. Okay. There's no specific physical therapy that I typically have patients doing after hip replacement surgery. I tell my patients that walking is their exercise afterwards. And really, by 4 or 6 weeks, patients are doing really well and kind of back to their usual activities.
Okay, and what's the success rate when it comes to hip replacement? Knee replacement's really high. Is hip replacement high too?
It is very high. Probably actually a little bit higher than knee replacement overall if you looked at all of the data from worldwide, really.
So close to 100%?
Close, yeah,
Okay, yeah.
I would say, yes.
Okay, that's great. Yeah. Okay, and so you said 4 to 6 weeks, that's a pretty average time that someone might be able to expect. Are there any times where there are complications where that might go a little bit longer?
If somebody had a really arthritic hip to begin with, sometimes if they had a big, what we call leg length discrepancy, so that leg would be a lot shorter than the other one from their arthritis. If their hip was really stiff before surgery, meaning that the muscles and tendons and ligaments around it all needed time to heal as well and become more limber after surgery. So in those cases, it can take a little bit longer.
Okay, and again, similarly to the knee replacement question, are there times when someone is just not a good candidate for hip replacement, or are there risks that they should know about if they could or could not be a good candidate?
And as with a knee replacement, it's mostly just overall health and being able to undergo an anesthesia from a heart, lung standpoint, that kind of thing.
Okay, and how long does a hip replacement usually last?
At least, hopefully at least 15 plus years. There's very good data out there to support that.
Okay, and are there times when people have had to do that sort of a thing twice too?
Sure, yeah, yep.
Okay, and so also asking, I know this is important for folks to know, health insurance, is a hip replacement something that they can expect their insurance to cover?
Yes.
Okay, that's good. Probably a relief for folks who are interested in something like that. And are there things that folks can do to make sure that hip replacement lasts as long as it should?
So I tell my patients that they can go do anything that they would like to do with their hip or their knee except run. And I think that running or high impact jumping activities, while you might feel like you could do them with your joint replacement, I don't think it's a good idea because I think it could lead to earlier wear of the joint.
Okay, so certain sports, things like that?
Yeah, I mean, I think people can hike and bike and swim. I allow people to downhill ski, play tennis, but a lot of running, basketball, high impact jumping, I don't think is a good idea.
Okay, gotcha. So let's back up long before the surgeries ever happen and just talk about somebody is experiencing either knee or hip pain. What do they do? What's their first step?
Oh, they can speak with their primary care provider if they'd like to. They can also call an orthopedist, either a non-operative orthopedist or an orthopedic surgeon. And our office, for example, you can call and make an appointment. You don't need a referral.
You don't?
No.
Okay. That was going to be my next question. So a referral is not required. You can just cut out the middleman and go straight to an orthopedic physician. Okay. And then if it is determined then that surgery is required, we've talked about, hospital safety and surgery safety on this show before. Can we talk a little bit about infection prevention and some of the things that can happen in surgery as far as patient safety goes?
Sure. Infection is a really big issue in joint replacement surgery. It's a subject that has a lot of attention is paid to because infection in that setting is just disastrous for patients and our healthcare system. So we have patients go through a process using a special soap before surgery, checking for what we call MRSA before surgery, and then when they're in the hospital receiving IV antibiotics, special dressing that we use, just really paying very close attention and close monitoring for that.
This might seem a little bit obvious, but can you talk about the difference between an orthopedic doctor and an orthopedic surgeon and when somebody should go see one or the other?
Sure. The orthopedic doctor maybe somebody, a primary care physician with an emphasis in sports medicine or orthopedics, who they just see patients in the clinic, maybe do some minor procedures in clinic, versus an orthopedic surgeon who sees patients both in clinic and operates.
Okay, perfect. Thank you so much for your time and all your expertise. We're out of time. That's our show. So I'd like to thank all of you at home for tuning in this week, and we hope you'll tune in again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.